Hi, my name is Michelle, and I'm going to be performing a neuro assessment today. This is my patient Quinn. And the first thing you would do when you walk into a patient's room is you would wash your hands and introduce yourself. So I'd wash my hands and I'd say, hi, my name's Michelle. I'm going to be your nurse today. How are you doing?
Doing good. How are you?
Good. So we're going to do a neuro assessment, and first we're going to start with your mental status. So the first thing you want to do is you want to look at their appearance, look at their posture, look at their clothing. Is it appropriate for like the weather outside, for their age and their gender? And you want to look at their body movement, so you want to see if there's anything happening that looks like involuntary, any jerking, any twitches in the face, and if everything just seems to be coordinated when he moves. So if you ask him to raise his arms up, if they go up symmetrically and there's no jerking involved, and also his hygiene. Is there any odor present? Does he look unkempt? Is his clothes have any holes in them? Things that would indicate homelessness or something like that. So the next thing you would do is you would assess his behavior. So you want to do the level of consciousness. Is he awake and alert? Yes, he is. You would look for any lethargy, if he's like going in and out of consciousness, if he seems really sleepy, eyes drooping, things like that you would want to assess. Next, you would do his facial expression. So when you talk to him, is he uncontrollably laughing? That would be something that's abnormal. You want to make sure that it's appropriate for the situation. His speech. So when you talk to him, if he's answering you in complete sentences, or if he's babbling, if his sentences don't make sense, that would be something that would be a red flag. If he's talking to you and he's just saying words all jumbled up that don't make sense. The next thing you would want to assess is his mood and affect. So you want to place them in a condition and see if their mood and behaviors change accordingly. So if you give a scenario, and he would just display the correct actions. Like if you would ask him, you're in a really happy situation, can you show me what it would look like for you to be happy? Things like that. So next you want to do his cognitive function. So you're going to ask him, do you know where you are right now?
Yes.
Where are you?
The doctor's office.
And you would ask him, do you know what time it is?
Yes. 12:30.
Okay. You would want to ask him if he knows like the month,
June.
The year.
2020.
Do you know who I am?
Michelle.
Your nurse.
My nurse.
You could assess his attention span. So you would ask him a series of questions, series of directions to follow. So I said, can you please pick up that remote? You would pick it up. Can you please put it back? Can you touch your nose? Thank you. You can put your arm down. You would want to assess his memory. You'd want to do both recent and remote. So for recent memory, you can ask him questions regarding the appointment time. So you can say, do you remember what time your appointment was for today?
Yes, 12:30.
Sure. And then of course, if it was like 5:30 right now, you would see that he doesn't remember what time his appointment was. So, when is your birthday?
August 12th, 1997.
Good. So you would also want to do a new learning that would assess the person's memory. So you'd ask for unrelated words. So I can say red, tulip, fig, and pizza. And then in 5 to 10 minutes, 5 minutes, 10 minutes, and 30 minutes, you would want to ask him again. So later in the assessment, we could ask him to repeat those words. So I'll just do an example right now. So can you repeat those words back to me?
Red, tulip, fig, pizza.
Good. And again, you'd want to do that at 5 minutes, 10 minutes, and 30 minutes. For writing, you can have a piece of pen and a paper. So let me grab a pen. and you would ask the client to make up and write a sentence. So I'd give him a piece of paper and pen, and I'd say, can you please write a sentence down? Thank you. So he wrote, I like soccer. Beautiful sentence. So next you would want to do judgment and insight. So you would ask, what would you do if inside a building and the fire alarm went off?
I would go to the stairs and get out of the building.
Good. So something appropriate like that. You wouldn't say, I would wait for the elevator, or I would try and pack up my desk because all my things are important. You would want it to be an emergency situation and to act appropriately. So the next part of the assessment is thought processes and perception. So for thought processes, you want to ask yourself, does the client make sense? Is he jumbling words? Is he not following commands? Does he not understand what's going on? Because the way the client thinks should be logical, goal-directed, and relevant to the situation. And the situation right now is our assessment and the questions that we're asking him. And perception as well, is our patient aware of reality right now, or does he think that he's at the beach? You want to make sure he's not having any hallucinations, staring off into space, not really being alert and with the assessment. And then lastly, you would want to screen for suicidal thoughts. A lot of places now also have like questionnaires that they would take before any certain assessments that would assess for suicide or depression. So then the next part of our assessment is the mini mental state examination, which is a test of cognitive functions. After they take their examination, you can ask them if they're having any problems, and then you could test certain cranial nerves, but you would also want to go through each cranial nerve and ask questions about it and see if they might not have, if they're having any issues with that they may recall once you go through the nerves. So the first cranial nerve is their olfactory nerve. So you would ask questions that regard taste and smell. So you'd ask the patient, can you smell in both nostrils?
I can.
Have you noticed any difficulties smelling or tasting any foods or smells in the environment?
No.
Good. And then you could also, if he says, I don't know, or, lately I've been not able to taste, or I think I'm not smelling everything as well as I used to, you could bring up a fragrance or like any food to test something with the taste and smell. So cranial nerve 2 is your optic nerve. So usually you would use the Snellen chart, and they would read across lines to test their vision. So you can always ask the patient, do you wear glasses or contacts?
Both.
Both, okay. Do you know your prescription?
No.
No, okay. So you could always and then you can ask, like, do you go regularly to your ophthalmologist?
I do.
Okay. And then you can always reach out to his ophthalmologist to get his specific prescription. But again, you would use the Snellen chart to read, have them standing 20 feet from the chart, and have them read it without their glasses on, and with their glasses on. If they have contacts, they would have to keep the contacts in, of course, to read it, because he would, unless he had stuff with him to take those out. You would also want to inspect the optic fundi using an ophthalmoscope. So you would assess that in the eye. You want to test visual fields by confrontation. You want to test his peripheral vision. If he could see side to side, so you could hold out fingers and say, tell me when you see my finger. Now, okay, good. So he has good peripherals on this side, and you would want to make sure you start at the same side and do both sides.
Now.
Good. So 3, 4, and 5 is his oculomotor, trochlear, and abductans. So you would want to, this is also with the eye, and you would test each corner basically of the eye to make sure that his muscles are working properly, that his eyelids aren't drooping. You would want to do perla, and you would want to use your pen light. You would want to test for perla as well, so you'd use your you would use your pen light, and on the side of a lot of pen lights, there's different sizes. So you would want to test it. You would want to see what size his pupil is, if it's really dilated or not. And again, on the pen light, they have 2, 3, 4, 5, all the way up to 8 millimeters, so you can see the size of their pupils. So you would take a look into their pupil, see if it's reactive and equal to both sides. If it does have a reaction to light, if you shine the light and there's absolutely no dilation or constriction and accommodation, you would also want to see for direct and consensual light. So if you shine the light and both eyes react and things like that. Okay, so the next cranial nerve is 5, which is your trigeminal. So you want to palpate the temporal and masseter muscles while his teeth are clenched. So I'd say, can you please clench your teeth? And then you would want to do all the temporal, do on the face. You would also want to lightly touch the forehead and cheeks and compare one side with the other to see if there's any tenderness or if there's even like loss of sensation there. And you will also want to do the corneal reflex. So your next cranial nerve is cranial nerve 7, which is your facial. You would want to test for weakness and asymmetry. So you would ask your patient, can you please smile for me? You would want to make sure that, one side of you could not smile, with certain like cerebral bell palsy, like sometimes when the patient smiles, his whole face will be non-reactive, so there would be a droop in the face or no change. You could ask him to lift your eyebrows up. You would want to make sure that they both happen at the same time, and just show your teeth for me. Good. Okay, so cranial nerve 8 is your hearing. So it's your acoustic nerve. You want to test their acuity with a voice test. You could use Weber and Rhines, which is you could use the tuning fork, and you would do this to test their hearing. And a lot of times you could even tell that the patient might be having trouble hearing if I'm on this side of him and I'm speaking and it takes him a long time to realize that I'm talking to him, or he answers the question in something that's not really appropriate. You can kind of tell if they have trouble hearing. If I step on that side, he hears me better and he answers a lot faster. So just things to look out for. So cranial nerve 9 and 10 are your glossopharyngeal and your vagus. So you can inspect the pharyngeal movement by asking the patient to say ah. So you would say, can you please open your mouth and say ah for me? Good. And then you would also use, you would want to test the gag reflex, and you could use this with like a popsicle stick or something, which I'm not going to do right now, but that you could test that at the same time. Cranial nerve 11 is your spinal accessory, so you'd want to inspect the sternomastoid and trapezius muscles, which are up here. You'd want to palpate them if there's any tenderness or resistance against the side of the chin. And you can also test the trapezius strength by asking them to shrug their shoulders. So can you please shrug? Good. And you'd want to do this on both sides so that you can see that maybe there's lopsidedness or there's no strength in those muscles. Okay, so your next cranial nerve is cranial nerve 12, which is the hypoglossal, so you'd want to inspect the tongue. So again, you could ask the patient to open their mouth, stick out their tongue. Good, you would want to make sure there's no ridges or divots in the tongue, it's not splitting. If it's a normal color, you want to inspect it. If it looks really short or they're having trouble with their speech, you can also ask them to say a couple of words so that you can test their speech. So I'd ask you to say the word light.
Light.
Say the word tight.
Tight.
And say the word dynamite.
Dynamite.
Good. Okay, so the next part of our neuro assessment is to do the motor system, which is starting off with his muscles. So you'd want to make sure that the size of his muscles are pretty much equal and symmetrical on both sides. You don't want to have a really frail looking arm on one side and then something bulky on the other side. So you would compare the right side with the left side always when doing any type of assessment, but especially with muscles. You would want to look at the biceps, ask him to flex his biceps for you. Yeah. So then you would want, to do your abduction and adduction. You could assess the wrist and ask him to extend and flex the wrist for you on both sides. Good. You want to make sure that he has good range of motion and everything is symmetrical. You can test his grip, so you can say, please grip my finger. Good. On both sides. Good. You would also want to do the same thing for the hips. So if he were to stand up and he were to move his legs in and out. Good on both sides. Good. You can sit. And the same thing with the knee. So you can have the knee come up to 90 degrees, flex out and in on both sides. Good job. And then lastly with the feet, you'd ask them to flex up and down. Good. And you could do it to the side. Good. Very good. So the next part is you would want to assess the tone. Does the muscle look relaxed? Is it all voluntary movements? Is anything involuntary? Is there any twitching? Something that would not normally occur. So moving on from motor, you would want to do the cerebellar function, which is all about balance and how they're walking, how their gait looks. So it's a little hard to tell in the video, but we can try. So you can please stand up and move the chair, and then just step all the way back. So you'd want to do a balance test. So his gait should be smooth and steady when he walks. You don't want his balance to look like he's not walking in a straight line. So you'd ask him, please walk forward. Good, and then walk backwards. So you'd want to make sure that, he's not falling all over the place, that his movements are smooth and steady. You do a tandem walk, so you'd have the client walk heel-toe. Good. Good, and you could just pedal back normally. So you'd want to do a Romberg test. So the person would stand with their feet together, arms at their side. Next, you want to tell them, can you please close your eyes? And you would hold this position for 20 seconds. There might be some slight swaying that occurs, which is normal, but otherwise the person should be able to stand with their hands together, feet together, eyes closed, and not be falling all over the place. Good, so you can open your eyes. You want to do a pronator drift. So the client should stand 20 to 30 seconds with both arms straight, palms up, and eyes closed. Good. So then you would tell the patient, I'm gonna tap your arms and move them normally, and they should be able to rebound back to the position. Good. Good. Perfect. So you could put your arms down. So you would want to ask them to bend their knees up. Good. Are you able to hop on one foot? Good. Do the other foot. Good. Okay, so the next part is we're going to move on to coordination and skilled movements. So the first one is rapid alternating movements. So you'd want to pat the knees with both hands. Good. And then you would want to lift up and turn your hands over and pat your knees cracked. Good. Very good job. Okay, so next you would want to do, you could sit actually for these next two. So next you do a finger-to-finger test where the client has his eyes open, he touches your index finger and then touches his nose. So you would tell him, please keep your eyes open and use your index finger to touch my finger and then touch your nose. Good. Good. Other finger. Good. And then you can, move your finger to a different position so that he would have to use, it wouldn't be just straightforward. You get some variation. The next is finger to nose test. So you would tell the client to close your eyes and stretch his arms out to the side. Good. And then you would ask him to touch the tip of his nose with alternating index fingers. Good. Very good. And then the last one for this is the heel to shin test. So the client places the heel on the opposite knee and run it down from knee to ankle. Good. Now down to the floor. Other one. Very good. So the next part of your assessment would be the sensory system. So this has to do with pain, touch, and reaction to that. So you would want to perceive their pain. So if you prick them, you would want to ask them, like, did you feel that I just pinched you?
I did.
You could assess their pain from 0 to 10. A slight pinch like that shouldn't be a 10 on the pain scale. You want to make sure that also that they're giving you an appropriate answer. You could also assess their tolerance for pain this way. Temperature, you would want to see if the pain is abnormal or if they're having any pain, if it's really hot, if there's swelling involved, and then if they can do light touch. So you'd want to use like a cotton ball or something. If you pretend it's a cotton ball and you would brush it, you would want to ask them if they felt it.
Did.
And you always want to do all of this on both sides because sometimes someone might not have feeling on both sides, so you'd want to make sure that you document that. Next is the posterior column tract. So you would test for vibration and position. After that, you would do tactile discrimination. If they could identify objects, numbers, and a lot of times they have other charts similar to the sound that have other like symbols and stuff like that. Okay, so lastly, you would want to do all the reflexes. So these are the deep tendon reflexes. It's hard to do a lot of these right now because his legs are in the dependent position. He's not high enough off the ground for them to be hanging to test the reflexes there. But you would want to do the knee jerk, or his quadriceps, his Achilles reflex, which is his ankle jerk. You would want to do the biceps and triceps. So biceps here, we got our triceps. Our brachioradialis reflex down here. And with these, you want to just check that they're not, first, if they're existent or non-existent at all. If they're really jerky or hyperactive, that's something that you want to document. His plantar reflex, which is the Babinski, where you slide up the foot and the toes will flare out and up. And any abdominal reflex